Hi, I'm Dr. Michael Reilly. I'm a double board certified head and neck, reconstructive, and facial plastic surgeon. I'm really glad you're taking the time to watch this quick informational video about septoplasty surgery. I would imagine you're contemplating whether to undergo the procedure, and I'm hoping to share some information with you to help in your decision-making process.
What is a septoplasty?
The septoplasty is a surgical procedure that I perform to correct a crooked or deviated septum. The septum of your nose is the bone and cartilage that divides the nose into two cavities. A crooked septum can be caused by trauma or can occur naturally. A deviated nasal septum can contribute to a range of nasal issues like nasal obstruction, chronic sinus infections, runny nose, and nosebleeds. Septoplasty is often performed at the same time as other nasal procedures like rhinoplasty, turbinate reduction, or sinus surgery.
How is a nasal septoplasty performed? Am I going to have scars from this type of surgery?
During septoplasty, I will remove, reposition, and strengthen portions of your nasal septal cartilage to stabilize the structure and improve the symmetry of the left and right nasal cavities. Septoplasty surgery is most often performed under general anesthesia and often done without incisions outside the nose. However, depending on the severity of the deviation, an external incision might be necessary between your nostrils. Usually that's about 5 millimeters in length.
Is my face going to be bruised? And will I have any bandages or splints on my face?
It is really unlikely to have visible swelling or bruising after septoplasty. Avoid drinking alcohol for the first week after surgery to prevent the risk of bleeding. Nasal packing is not usually required, but you will likely have thin plastic splints inside your nose for the first week post-op to help reinforce the septal correction and to prevent scarring.
Am I going to be in any pain or discomfort after this surgery?
You should expect to be very congested for the first week after your procedure and will likely be breathing from your mouth during that time. I recommend using a nasal saline spray about 3 times a day to ensure the tissues stay moist and to help with congestion. I will provide a prescription for pain medication for you after surgery, but many patients can manage their discomfort with over-the-counter Tylenol.
When can I expect to get back to work?
I recommend taking a full week off work or school to adequately rest and recuperate from your deviated septum treatment. We will see you in clinic 1 week after your procedure to ensure everything is healing properly and to remove the splints that are inside your nasal cavities. Depending on your occupation, you may be filling up to returning to work after that first week, but you should avoid heavy lifting or strenuous exercise for a full 2 weeks.
Okay, so how much does a deviated septum surgery cost?
Deviated septum surgery is typically submitted to your insurance company and covered under your medical benefits. We have a team who will help navigate you through that scheduling and authorization process. Thanks so much for listening to me tell you a little bit about septoplasty surgery, and I look forward to meeting you.